Assalamualaikum and a very good morning I bid to you. Okay, in meeting 5 we have discussed on obesity. In that meeting we have discussed about the causes, the effects, and the causes, the effects, and the ways to overcome obesity to be happen. So firstly, as a biology students, I would like to explain how the obesity can be happen. So when we eat excess food, so we tend to have excess glucose, and the excess glucose will be converted in the liver, will convert it into glycogen. So when we do not do any exercise, so the excess glycogen can be produced. So when the excess glycogen in liver, it will convert into fatty acid. So excess fatty acid can be embedded in at the adipose layer. So when we didn't do any activity, so the adipose layer becomes thicker, and the level of cholesterol become higher. So that's why obesity can happen. So obesity is a very detrimental disease to human, as well as according to statistics, obesity is one of the most killer in the world. So most killer disease in the world. So just I said just now, like I suggested, okay, obesity can reduce life expectancy by increase the heart problems. So heart problems is one of the major serious disease that can affect the life expectancy. So firstly, the patient can be exposed to the detrimental disease such as cardiovascular disease, osteoarthritis, obstructive sleep apnea, diabetes mellitus 2, type 2 very at the critical level, and then certain types of cancers, and asthma, and the worst one is coronary heart disease. So we all know function of heart is to pump our blood to all of part of our body. So when the fatty acid embedded to the heart, so the heart cannot be function efficiently. So that's why the obese person can have lots of disease at the same time, because they can have obesity, can have a diabetes, as well as heart problems. So this will increase the risk of mental and physical problems, because most of them, I believe, most of them have sedentary lifestyle, which is they prefer to be sitting on the couch while watching television and eating something with not moving, not much of movement. So by this way, they didn't do any exercise, so they tend to have obesity. Okay. So the rate of their thinking also become lower because of the inactive body, because of their inactive body, which can affect their academic matter, especially for students. So as the result, they cannot excel both in academic and curriculum. So in fact, these two parts is very important to enter in institution, because these two is the main requirement to enter any universities in either local or abroad. So the effects of obesity give very adverse consequence in our life if we not taking very serious in food matter. So we have to pyramid food that is suggested by the doctor. So when we do this, and we have to do some exercise, uh, for example twice a week, so we can reduce the tendency to have obesity. So I think that's all from me. Thank you.